Content advisory. This podcast addresses sensitive topics relating to eating disorders and body dysmorphia, including detailed descriptions of disordered eating behaviors and body image struggles. Please be aware that the following content may be distressing or triggering for those who have faced or are currently dealing with these difficulties. You're listening to Behind the Mask, the show where we meet once a month to discuss mental health. Welcome to the 7th episode of the school year. I'm your host, Jocelyn Torres, and today we are going to get deep into eating disorders and body dysmorphia. According to the well-known Mayo Clinic's online blog, eating disorders are serious health conditions that cause harm to one's physical and mental health. This affects how a person thinks about food, eating habits, weight, and body image. Although there is no exact cause of eating disorders, they can occur due to chemical imbalances in the brain. They can also be fueled by bullying, dieting, other mental health issues, or stress. Complications that can occur are serious health problems, anxiety, depression, suicidal thoughts and behaviors, issues with growth, and death. The National Institute of Mental Health identifies 4 types of eating disorders. The first is anorexia nervosa. People with anorexia typically eat small quantities of specific foods, restrict food, or avoid food at all costs. Within anorexia, there are 2 subtypes, restrictive and binge purge. Restrictive anorexia is when people severely limit how much they eat. The binge purge subtype occurs when people restrict food but have episodes where they eat large quantities of food in one sitting, following it with throwing up or taking laxatives to get rid of what they ate. People with anorexia are normally unhealthily underweight. The second type of eating disorder is bulimia nervosa, which occurs when people feel like they cannot control their eating and have common recurring episodes of eating large quantities of food, followed by forcefully throwing up, exercising excessively, using laxatives excessively, fasting, or a combination of these. Throwing up can commonly affect one's dental hygiene because stomach acids can reach one's teeth when throwing up. Unlike those with anorexia, people with bulimia are usually of normal weight or possibly overweight. The third type is a binge eating disorder, where people lose control and eat large quantities of food in one sitting. Unlike bulimia, there is no purging or fasting after eating. Lastly, avoidant restrictive food intake disorder, also known as ARFID, is when people limit the amount or kinds of food they consume. A difference between ARFID and anorexia is that with ARFID, there is no fear of weight gain. ARFID is most likely to appear early in life around the middle of childhood. Similar to those who are picky eaters, people with ARFID may not enjoy certain foods, but are not receiving the necessary or healthy amount of calories to properly grow. According to the Mayo Clinic, there are multiple treatment options for those with eating disorders. The first is to seek help from a medical professional. A psychologist can provide a person with psychological therapy, also known as talk therapy, to suggest ways to manage the disorder and prescribe medication if necessary. Additionally, a dietitian can educate a person on nutrition and help with meal planning. Dentists and medical specialists can help treat any health or dental problems that one may experience because of an eating disorder. Creating a treatment plan and setting goals for overcoming one's disorder can help a person develop a less restrictive eating habit. It also helps them know what they have to do if they are having trouble following the plan. If a person has financial limitations, they should talk to their treatment team about their concerns. Medications are not the cure for an eating disorder because there is no cure. However, antidepressants can reduce depression or anxiety one may be feeling, so the Mayo Clinic recommends combining medication and therapy. Hospital day treatment can also be effective. This is when a person attends group therapy sessions multiple days a week. Along with therapy, hospital day treatment provides structured eating sessions and nutrition education. Residential treatment is recommended if one needs long-term care. If a patient's mental and physical health does not improve, they may need to temporarily live in an eating disorder treatment facility. According to the International OCD Foundation, eating disorders work in connection with body dysmorphia, or BDD, and 1/3 of people with eating disorders also have body dysmorphia. Symptoms of body dysmorphia include being obsessed with a flaw no one else notices, a strong belief that there is a defect in one's appearance, behaving in ways to fix or hide that perceived flaw, comparing one's appearance to others, and seeking reassurance about one's appearance. Because of their perceived flaws, people with body dysmorphia may feel embarrassed or anxious to partake in certain social situations. Just as with eating disorders, the National Health Service reports that there is no direct cause of body dysmorphia, but there are possible risk factors. A person is more likely to develop body dysmorphia if they have a relative with body dysmorphia, obsessive-compulsive disorder, or depression. Other reasons could be a chemical imbalance in the brain or trauma caused by abuse or bullying. Johns Hopkins Medicine recommends cognitive behavioral therapy, or CBT, which is the most effective talk therapy, along with antidepressants. Lastly, I'll leave you with a reminder to look for a support system. Eating disorders and body dysmorphia are damaging to one's mental and physical health, and it is not something to go through alone. So talk to trusted friends, family, and adults so they can offer support. Thank you for tuning in, and come back next month to see what else is behind the mask. I'm your host, Jocelyn Torres, signing off.